This is a COVID-19 induction training for school staff in post-primary schools. Aims of the induction training. The roadmap for the full return to school sets out what the operation of schools will look like and the range of supports which will be available. As part of the return to work protocol, all staff are required to undertake COVID-19 induction training. This training is based on the requirements of the return to work protocol and the interim health advice from the Health Protection Surveillance Centre for the safe reopening of schools. The aim of this training is to provide you with information on COVID-19 symptoms, advice and guidance on public health, what to do if a staff member or student develops symptoms of COVID-19 while at school, and provide an outline of the COVID-19 response plan. Well-being and safety. The well-being of our school communities is a fundamental element of our overall plan to ensure a successful return to school. Promoting a sense of safety helps students believe their needs will be met and their overall well-being supported. Feeling safe helps to reduce the impact of stress and anxiety so that we are able to think, plan, engage and learn. The well-being key messages on the return to school are safety, calm, connectedness, self and community efficacy, and hope. Section 1. Return to work induction. The Health and Safety Authority training. This is a training module developed specifically by the Health and Safety Authority for all employees. This will inform you about COVID-19 and how to stop the spread of the disease and precautions to take. This will take about 20 minutes to watch. Please continue watching this video to complete the training.
This Return to Work Safely induction has been developed by the Health and Safety Authority. The Return to Work Safely protocol is the key document your employer must follow for reopening your workplace. This course has been designed to help you to understand the protocol requirements for returning to work. One of these requirements is that workers must complete induction training. Your employer will provide additional information, advice and training on COVID-19 measures in your workplace. The induction course is 20 minutes long and has 4 topics: employer and worker responsibilities, preventing the spread of COVID-19, signs and symptoms of COVID-19, and further information and advice. When you complete your Return to Work Safely induction, you should be able to identify employer and worker responsibilities for returning to work safely, demonstrate good hand hygiene, respiratory hygiene, and physical distancing, recognise the signs and symptoms of COVID-19, outline the role of the lead worker representative, and source current information and advice on COVID-19. Topic 1. Employer and worker responsibilities. The Return to Work Safely protocol outlines the measures to be put in place to prevent the spread of COVID-19 in the workplace. The protocol is designed to support employers and workers. Make sure you complete a COVID-19 pre-return to work form at least 3 days before you go back to work. Give this form to your employer. The form is to confirm that you do not have COVID-19 symptoms, you are not self-isolating, you are not waiting on results of a COVID-19 test, and you have not been in contact with someone who has the virus. Tell your employer if there are any other circumstances relating to COVID-19 not included in the form, which may need to be disclosed to allow your safe return to work. It is important to follow any measures your employer has put in place to protect you, including attending training to complete your COVID-19 induction, taking note of COVID-19 signs and information, using personal protective equipment provided to you as instructed, not sharing objects that touch your mouth, for example cups or pens for writing, and not shaking hands or making close contact with others. The HSE has specific information for persons at very high risk, also called extremely vulnerable, and those at high risk from coronavirus. Speak to your employer about any concerns you may have if you are in one of these categories. Follow the most up-to-date public health advice and information on the Health Service Executive's website. Topic 2. Preventing the spread of COVID-19. It's important to follow all COVID-19 measures in place in your workplace to help prevent the spread of the virus. The steps you take can make a big difference in helping to keep everyone safe. There are 3 essential measures for preventing the spread of the virus: good hand hygiene, respiratory hygiene, and physical distancing. You will be familiar with these measures already.
Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Keeping 2 meters apart from other people will help to protect you. However, some work will require closer physical contact, and your employer will need to have a number of additional safety measures in place. These measures may include the installation of screens or the provision of suitable PPE. You will also be aware that cleaning and disinfecting has significantly ramped up since the start of the pandemic. This is another important measure for preventing the spread of the virus and must be carried out regularly and properly. Under the Return to Work Safely protocol, each workplace will appoint at least 1 lead worker representative to help ensure that COVID-19 control measures are in place. The lead worker representative helps to put these measures in place. They communicate with your employer and assist in providing COVID-19 health advice to workers. You should know who this person is and bring any concerns you may have to their attention. If you get symptoms of the virus at work, stop working and inform your employer or manager immediately. There will be systems in place for handling the situation. You will need to follow the isolation procedures in place and wear a face covering where provided. The lead worker representative must receive training for their role, and there may be more than 1 representative appointed, depending on the size of your workplace. Topic 3. Signs and symptoms of COVID-19. If signs and symptoms are picked up early, fewer people become infected and intervention can begin quickly. Here is a short video from the HSE on COVID-19 symptoms and what to do if you think you have them.
COVID-19 or coronavirus is here, so it's important to have the correct information at hand, like knowing the symptoms: a high temperature, a cough, shortness of breath or breathing difficulties. If you have symptoms, self-isolate to protect others and phone your GP. Visit hse.ie for updated factual information and advice, or give us a call. Protection from coronavirus. It's in our hands.
Remember, common symptoms of COVID-19 are a cough. This can be any kind of cough, including dry, shortness of breath or breathing difficulties, a fever, which means a high temperature, 38 degrees Celsius or above, and loss or change to your sense of smell or taste. If you experience any of these symptoms, stay at home, self-isolate, and phone your GP. Stay out of work until all symptoms have cleared following self-isolation. Visit hse.ie for the most up-to-date public health information. Topic 4. Further information and advice. There's lots of information and advice on COVID-19 for employers and workers returning to work. Your employer will put in place COVID-19 control measures and will give you information specific to your workplace. As mentioned earlier, workers should complete a pre-return to work form and give this to their employer. Have a look at the Health and Safety Authority's COVID-19 webpage and view checklist number 6 for workers and other resources. This information will help you to prepare for returning to work. A short online course for lead worker representatives is also available. Looking after yourself physically and mentally is very important. Try to get your news from trustworthy and reliable sources, and consider limiting your screen time. Keep to a routine if you can. Take exercise and stay connected with family and friends. These measures can make a difference to your health and well-being. You may be interested in the HSA podcast on managing stress and potential stressors when returning to work under COVID-19. This can also be found on the HSA webpage.
You are now aware of COVID-19 and how to protect yourself from contracting the disease. The remaining training will guide you on how to prevent the spread of COVID-19 in school. Section 2. Controlling the spread of COVID-19 in school. Control measures. How to prevent introduction and spread of COVID-19 in schools. Promote awareness of COVID-19 symptoms. If you have symptoms, do not attend school. Phone your doctor and follow HSE guidance on self-isolation. If you have been identified by the HSE as a contact for a person with COVID-19, do not attend school and follow the HSE advice on restriction of movement. Students with symptoms, or students who have been identified by the HSE as a contact for a person with COVID-19, should be made aware not to come to school. If you develop symptoms at school, bring this to the attention of school management promptly. Your school's COVID-19 response plan will contain information on all these arrangements. Get familiar with the response plan. When entering the school building, use the hand sanitizer provided. Visitors to the school, including parents, is by appointment only. Maintain physical distancing with visitors where possible. Know the protocol for managing a suspected case of COVID-19 in your school. The importance of good hand hygiene. Promote good hand hygiene by hand washing or use of hand sanitizer. Hand sanitizer dispensers will be deployed in your school at exit and entry points and in classrooms. Care should be taken to clean up any hand sanitizer spills to prevent risks of falls. Evidence of effectiveness is best for alcohol-based hand rubs, but non-alcohol-based hand rubs can also be used. Warm water is preferable to hot or cold water for hand washing. If only cold water is available, then use a soap that emulsifies easily in cold water. Please watch the following video which demonstrates best practice guidance on how to rub hand sanitizer into your hands correctly.
Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
When to wash hands and use sanitizer. All staff and students should perform hand hygiene on arrival at school, before eating or drinking, after using the toilet, after petting animals, after playing outdoors, when their hands are physically dirty, and when they cough or sneeze. Importance of good respiratory hygiene. You should practice and promote good respiratory hygiene. Posters demonstrating respiratory etiquette will be displayed to help promote this practice with students. Cover your mouth and nose with a tissue or your bent elbow when you cough or sneeze. Dispose of used tissues immediately and safely into a nearby bin. Good respiratory hygiene will help protect the people around you from viruses such as cold, flu, and in particular COVID-19. Physical distancing. Physical distancing can be usefully applied in a post-primary school setting, allowing for some flexibility when needed. It must be applied in a practical way to recognise that the learning environment cannot be dominated by a potentially counterproductive focus on this issue. It is acknowledged that staff will not always be able to maintain physical distance from their students, and this is not expected where it may have a detrimental impact on the student. However, where possible, you should maintain a minimum of 1 metre distance and if possible 2 metres from others in the school. You should also take measures to avoid close contact at face-to-face level. For example, remain standing rather than sitting beside or crouching down. The layout of your school may look different when you return due to physical distancing requirements. Schools are best placed to decide on the appropriate configuration for their school. The department has developed a framework to maintain physical distancing in the classroom in post-primary schools. You should be aware that physical distancing falls into 2 categories. 1, increasing separation, and 2, decreasing interaction. Physical distancing of 2 metres where possible, or at least 1 metre, should be maintained between desks or between individual students or staff. Further guidance on decreasing interaction is set out in the response plan. Use of PPE in schools. Face coverings will be required for all staff and students if a physical distance of 2 metres cannot be maintained. Consideration should be given to the use of perspex screens in reception areas, where it is not possible for staff to maintain a physical distance of 2 metres from other staff or students. The Minor Works funding grant can be used for this purpose. PPE will also need to be used at certain work activities or work areas. These might include roles such as performing intimate care, where a suspected case of COVID-19 is identified while the school is in operation, where a staff member in a high-risk group is attending the workplace and maintaining physical distancing is difficult, administering first aid, or parent-teacher meetings. Appropriate PPE will be available for dealing with suspected COVID-19 cases, intimate care needs, and for first aid. You should be aware of where and from whom to obtain PPE in your school if required. Guidance on the use of PPE is available from the HSE and should be included in your school's COVID-19 response plan. Additional considerations for those with special educational needs. For children with special educational needs, maintaining physical distancing in many instances will not be practical or appropriate to implement. The focus should therefore be on emphasising that parents or guardians should have a heightened awareness of signs, symptoms, or changes in baseline which suggests illness or COVID-19 infection. Where symptoms are present, children should not attend school. Children who are unable to wash their hands by themselves should be assisted to clean their hands or use sanitizer as appropriate. Use of face coverings in schools. Advice from the HPSC recommends that face coverings be worn by staff and students where it is not possible to maintain a physical distance of 2 meters from other staff or students. Face coverings act as a barrier to prevent respiratory droplets travelling into the air. They are intended to prevent transmission of the virus if the wearer coughs, sneezes, talks, or raises their voice. And they help to prevent the spread of disease from an infected person who may not know they are infected. In certain situations, the use of clear visors should be considered. For example, for staff interacting with students with hearing difficulties or learning difficulties. All students on the post-primary transport scheme should be asked to wear face coverings unless there is a good reason not to do so. Use of face coverings in schools. Face coverings should not be worn by any of the following groups: any person with difficulty breathing, any person who is unconscious or incapacitated, any person who is unable to remove the face covering without assistance, any person who has special needs and who may feel upset or very uncomfortable wearing the face covering. Face coverings should be stored in a space designated for each student, for example, labelled containers. They should be washed after every day of use or if visibly soiled, and they should not be worn if they are wet. A wet cloth face covering may be difficult to breathe through. Additional disposable face coverings may be available for students, teachers and staff in case a backup face covering is needed during the day. Wearing a face covering or mask does not negate the need to stay at home if symptomatic. Section 3. What to do if a staff member or student develops symptoms of COVID-19 while at school. Dealing with a suspected case of COVID-19. Your school will have a designated isolation area with an identified isolation route. You should make yourself aware of your school's arrangements as set out in your school's response plan. The following procedures must be implemented if a staff member or student displays symptoms of COVID-19 while at school. 1. If the suspected case is a student, the parents or guardians should be contacted immediately. 2. Isolate the person and follow the procedures in place to accompany the individual to the designated isolation area. 3. You should keep a distance of at least 2 meters from the symptomatic person and make sure that others also maintain a distance of 2 meters from the symptomatic person. 4. The isolation area does not have to be a room, but if it is not a room, it should be 2 meters away from others in the room. 5. If it is not possible to maintain a distance of 2 meters, a staff member caring for a student should wear a face covering or mask. Gloves should not be used as the virus does not pass through skin. 6. The person presenting with symptoms should be wearing a mask. If they don't have one, they should be given one. 7. Assess whether the individual who is displaying symptoms can immediately be directed to go home or be brought home by parents who will call their doctor and continue to self-isolate at home. 8. Facilitate the person presenting with symptoms remaining in isolation if they cannot immediately go home and facilitate them calling their doctor. 9. The individual should avoid touching people, surfaces and objects. Advise the person to practice good respiratory and hand hygiene. 10. If the person is well enough to go home, arrange for them to be transported home by a family member as soon as possible and advise them to inform their doctor by phone of their symptoms. 11. Public transport of any kind should not be used. 12. If they are too unwell to go home or advice is required, contact 999 or 112 and inform them that the sick person is suspected of having COVID-19. 13. Carry out an assessment of the incident which will form part of determining follow-up actions and recovery. 14. Arrange for appropriate cleaning of the isolation area and work areas involved. The HSE will inform any staff or parents who have come into close contact with a diagnosed case via the contact tracing process. Section 4. COVID-19 Response Plan. What is the COVID-19 Response Plan? A COVID-19 response plan is designed to support the staff and Board of Management in putting measures in place that aims to prevent the introduction and spread of COVID-19 in the school environment. It details the policies and practices necessary for a school to meet the government's return to work protocol and the Department of Education plan for school reopening that will aim to prevent the introduction and spread of COVID-19 in the school environment. The COVID-19 response plan is a living document and will be updated in line with public health advice as appropriate for post-primary schools. You should familiarise yourself fully with your school's COVID-19 response plan. The assistance and cooperation of all staff, students, parents, contractors and visitors is critical to the success of the plan. What is the school COVID-19 policy? A school's COVID-19 policy outlines the commitment of the school to implement the COVID-19 response plan and help prevent the spread of the virus. The policy will be signed and dated by the chairperson of the Board of Management and principal and brought to the attention of the staff, students, parents and others. A template of the school COVID-19 policy has been provided by the Department of Education. Procedure for returning to work. In order to return to the workplace, you must complete a return to work form, which is available online or from the principal. A return to work form should be completed and returned 3 days before returning to work. You must be familiar with the content of your school's COVID-19 response plan. Lead worker representative in school. A protocol for the appointment of a lead worker representative in schools has been agreed centrally between the department and education partners. The role of the lead worker representative includes representing all staff in the school, working collaboratively with school management in relation to COVID-19, assisting school management with the implementation of measures to suppress COVID-19, make representations to school management on any issues of concern in relation to COVID-19. Separate training will be made available for the lead worker representative. The impact of COVID-19 on certain school activities. It is important to be aware that COVID-19 will have a significant impact on certain school activities. This will be factored into the school's COVID-19 response plan. Care will need to be exercised where electric devices, musical instruments, or sports equipment are shared among students. The department will work with stakeholders to provide more detailed advice on certain school activities in advance of school reopening. Hygiene and cleaning in schools. General information. All staff will have access to cleaning products and will be required to maintain cleanliness of their own work area. Staff should thoroughly clean and disinfect their work area before and after use each day, and staff must use and clean their own equipment and utensils, for example cups, cutlery or plates. Shower facilities shall not be available for use by staff or students due to the risk associated with communal shower facilities and areas. The Department of Education will provide additional funding to schools to support the enhanced cleaning required to minimise the risks of COVID-19. Section 5. Recap on staff duties and outline of supports available. Here's a recap on the main staff duties. Complete the return to work form before you return to school. Inform the principal if there are any other circumstances relating to COVID-19 not included in the return to work form which needs to be disclosed for your safe return to school. Complete COVID-19 induction training and any other training required prior to return to school. You must be aware of and adhere to good hand hygiene and respiratory etiquette practices. Keep yourself fully informed of the updated advice of the public health authorities and comply with same. Familiarise yourself with the school COVID-19 response plan. Work with colleagues to ensure that physical distancing is maintained. Wear a face covering where a 2-metre distance cannot be maintained. Be aware of the symptoms of COVID-19 and monitor your own well-being. Do not attend school if you have symptoms of COVID-19. Self-isolate at home and contact your doctor if you display symptoms of COVID-19. If you develop any symptoms of COVID-19 while at school, adhere to the procedures outlined in the response plan. Supports for schools and staff. The roadmap for the reopening of schools. The Department of Education has published a detailed roadmap in relation to the safe reopening of schools in August and September. Specific guidance for schools. As part of the roadmap, the Department of Education has published a range of guidance documents for schools. Guidance is provided on a range of issues, including re-engaging with students, support the well-being of students, and curriculum and assessment issues. The National Council for Special Education are currently developing resources to support children transitioning back to school and children transitioning from preschool to primary school. They will be available on the NCSE website. Additionally, the National Education Psychological Services, or NEPS, has developed a range of supports for teachers and school staff in relation to their own well-being and to supporting the well-being of students. And you can see these in the separate slides that follow. Spectrum Life, the new dedicated employee assistance provider for teachers and school leaders, has also developed a range of supports. And you can see these in the separate slides that follow. Information on the supports and guidance available for school staff is available on the Department of Education website at the following address. This link is also available below in the description of this video. Wellbeing support for staff. You can find contact details here for the new employee assistance service, Spectrum Life. Other supports include in-school support, PDST support service, HSE health promotion team, HSE funded services for free one-on-one. School wellbeing supports. A web page with access to all information relating to the reopening of schools, including information about well-being with links to resources, guidance and support. A NEPS wellbeing webinar for primary, special and post-primary schools, supporting well-being as schools reopen. A NEPS wellbeing toolkit for teachers with a range of easily downloadable, user-friendly materials. Access to a range of aligned support and resources and professional learning opportunities provided by the department's support services and agencies. Access to additional guidance posts at post-primary level to support well-being. Services provided by NEPS, casework, support and development, with enhanced focus on special school communities. E-mental health services, including online counselling, provided by the HSE and HSE-funded service providers including spunout.ie, Jigsaw, My Mind, Childline and Turn to Me. Further training modules are available to provide specific information for cleaning in schools, special needs assistance, and school bus escorts. Thank you for taking part in this training. We hope you find this useful on your return to school. Further information is available at www.gov.ie/back to school.